From MTA International Studios in Los Angeles, California, this is Open Forum. And today we're going to talk about cancer or abnormal cell growth. We have two great experts in the room who are going to explain how to assess if someone is developing cancer, treatment for cancer, and then we'll talk about prevention. So with me today is Dr. Abdul Wahid Khan, who is the radiation oncologist in Chicago. Welcome to the show.
Assalamu alaikum.
And next we have Tahir Ijaz, Dr. Tahir Ijaz, who's also a radiation oncologist in San Diego, California. Welcome to the show.
Assalamu alaikum. How are you?
Great. So let's get started. Tahir, tell me about what is cancer?
Cancer is actually a group of diseases. It's not like one disease. And so it's basically an abnormal growth. As you said, it's sort of bizarre cells that are developing that are unrestrained. And they sort of take over the body's metabolism and cause a lot of potential damage, and it spreads. So essentially, it's uncontrolled cell growth.
So what is a cell? I mean, this is not something that's easily detectable, right?
But cell is a built unit,
Okay.
the unit of the body. And when there is disease, it affects the genetics.
Okay.
We call it mutation. Certain
Okay.
cells will go mutation, the DNA will change. And each subsequent cell that is made is cancer cell. In the body, there is an orderly fashion of cells being formed, damaged, replaced, and repaired. With cancer, that mechanism is affected. So cancer cell will be growing and it will spread to other areas, metastasis. So any growth that spread to other areas is cancer with metastasis.
I see. Okay. Okay, that's helpful. So tell me a little bit about, you said a group of diseases. What are the most common? What are we talking about here?
Well, well, globally and also in the USA, there's different
Okay.
prevalences of cancers.
Are there 10, 20, 30?
So there's actually hundreds.
Hundreds?
Literally
Okay,
hundreds.
that's why it's so complicated.
So for example, breast cancer has many different kinds of cells, getting
Okay.
back to the cell point. So
Yeah.
each cell will have a different type of tumor. Similarly, lung cancer has different cells within it. So different cells, when they become abnormal, there's different types of lung cancer.
I see.
So you can see that every single organ has
A unique.
dozens of types of cancers sometimes potentially.
Wow. Wow. So there's hundreds.
So hundreds.
So that's why it's so complicated.
That's why it's complicated.
So let's switch. What are the most common ones?
Lung cancer,
Lung cancer?
colon cancer,
Colon cancer?
breast cancer,
Breast cancer?
prostate cancer.
Prostate cancer? Okay. Those are your top four.
Yes.
Okay. And so lung cancer is the most, the top one. What causes lung cancer?
Lung cancer is mainly from tobacco use. There are
Wow,
many forms that are
So the
non-tobacco.
biggest cancer is from tobacco use.
Tobacco use, completely preventable.
Wow.
Completely preventable. In fact, not just lung cancer, tobacco is related to many other cancers as well. People don't know, but often bladder cancer is related to smoking as well.
Wow.
And so that's the single most preventable thing. The other thing is actually, the most common cancer is actually skin cancer, basal cell, just from the sun.
Wow. Okay.
So I'm talking now globally. That's actually the most common tumor in man is skin cancer.
In men. Okay.
In actually men and women.
Men and women.
Yeah.
Okay.
Fortunately, it's rarely treatable.
Okay.
But that's actually the single most common.
It's
tumor
rarely
in
treatable? What does that mean?
Amenably treatable. It's quite treatable.
Oh, it is
Quite
treatable. Oh,
yes,
okay.
yes.
That's great. Oh, that's great. Okay.
Yeah.
And so you said then the prostate cancer. Are there any causal relationships for that?
No.
Okay. So this is just
aging.
we don't know.
Just
Okay.
aging.
Just natural aging. So let's talk about these top four or others. Are there signs? I assume the earlier you detect cancer, the better your chances of being healed from it. So are there ways to assess and warning signs? What are warning signs for different types of cancer? Let's go through each one. What's the lung cancer? What are warning signs?
Cough, bleeding,
So blood when you're coughing? Okay, okay.
unexplained weight loss.
Unexplained weight loss. Most people love weight loss, so that's okay.
It's unexplained.
Okay, okay, okay. Okay, so those are signs where you may have lung cancer, you're coughing, and you have blood, or you're losing a lot of weight.
Yes.
Okay.
Fatigue.
Fatigue. Okay. Okay. You're just not okay. Let's go to the next one.
There's prostate cancer is very common in men, and unfortunately, that's one that could be fairly silent for years and years. In late stages, it presents with difficulty with urination, the reduced flow with urination, occasionally even pain. That's a sign of pretty advanced cancer. And
so there's no way to detect it?
There is a way to do it. That's with chemical testing, with blood testing.
But you wouldn't know to go to
You would not know, no. And so there's various guidelines. Maybe we can go into that later,
sure.
when to test and whatnot. Okay. But prostate is one that could be a little bit silent.
So, what about stomach cancers? Because liver, all those areas, are those common? Or
liver very common globally, again, because of hepatitis B. And
what is hepatitis B?
It's a virus that's in the environment that you can acquire through, blood transfusions, bad needles, and so. And so liver cancer is typically manifested, again, as weight loss, as abdominal pain. Often you get fluid in the abdomen in late stages. And so those are signs.
Oh, I see. So those are
basically jaundice. You can have a jaundiced appearance.
What are the types of cancer where you can detect? Kind of like lungs seem like you can have some early detection?
Yes, it's possible. Any cancer can be detected earliest if it causes symptoms.
Okay, yeah.
There are 7 warning symptoms of cancer.
Okay, yeah. What are those?
Unexplained weight loss.
For all types of cancer?
For cancer.
Okay.
Changes in bowel habits.
Bowel habits, okay.
Yeah.
Okay.
If you're constipated, especially rectal bleeding is a common cause of rectal cancer.
Okay.
Any lump in the body. A painless lump is more serious than a painful lump.
Wow,
that's scary.
Painless
lump in the neck or breast, it needs to be checked right away.
Okay, painless lump. Right. And a lump is just a bump, if you will, right? I mean, just a abnormal growth. Right. Okay. Bowel movement, pain, weight loss, a bump, a painless bump.
Bleeding.
Okay.
Rectal bleeding, bladder bleeding.
Oh, just from your nose, from
rectum.
Oh, rectum. I see. Okay, rectal bleeding. Okay.
Most common cause of result of the colon cancer is rectal bleeding.
I see.
So any rectal bleeding should be checked right away.
Okay.
It's usually from hemorrhoids. One thing to be kept in mind is that all these symptoms are present in many benign conditions too.
I see. So it's so hard to, yeah.
So it's hard to, just one symptom may not be enough.
Okay.
You have to look for many symptoms, and that's why.
And in a lot of places where you can't afford medical care, or you have challenges, so you've got to, people just hesitate going to the doctors, Southeast Asians in particular, that I know.
And not just there, but I recently was on a Humanity First tour of Guatemala.
I see.
Where we did cancer screenings.
Oh, did you? Wow.
And the women there are often, very embarrassed to bring up, even all of the gynecological, like bleeding and things like that. But, there's a lot of taboo in approaching these things and embarrassment. So the single most important thing is not to ignore these warning signs. Mm-hmm. I mean, if the bleeding is continuing, if the lump is not going away in a reasonable amount of time.
What is a reasonable amount of time?
I would say weeks, depending on the situation.
Wow.
Now, the most common presentation for example, breast cancer, very common, is a painless lump, as Dr. Saab mentioning. Painless lump is a very common sign. I would actually propose that a lump in the breast should be evaluated within days.
Wow.
It should be
So
seen right away.
Get it right away.
Seen
Okay.
right away.
Okay, take that seriously.
Absolutely.
Okay.
Absolutely.
Okay.
And so, and similarly, other symptoms. Main thing is
did we cover all the symptoms?
Yes.
All 7? Okay.
Yeah, so if we take the common ones, colorectal, breast, lung, prostate, I think we covered most of the common ones.
Good.
Yeah.
Okay.
Skin changes and skin lesion.
Skin lesion. What is that?
Any rash.
Okay.
Or if there's a mole, that changes
skin
color.
Cancer. Yeah.
Okay. Okay. And is it true skin cancer? If you have darker skin, it's a little. You're okay. Because a lot of folks who have a little darker skin, they're like, I'll never get skin cancer.
Much less common
okay.
in more pigmented folks like us.
Yeah. Okay.
But
okay.
I see a lot of skin cancer in my practice because a lot of the Northern European
Diego,
ancestry, a lot of the surfers.
Yeah.
They grew up before people realized that the sun was really bad.
Right.
In fact, that's probably the most common cancer that I'm seeing in my office. Actually, is just the sun worshiping people. Getting all these basal cells, the type of cancer, squamous cells, melanomas, for example.
So that is to really focus. Sunscreen is important for whatever your pigmentation is, would you say?
Absolutely. I've seen this even in Hispanic populations. They get it. It's less common.
Okay.
But protective headgear and skin blocks, if we're going to be in the sun for a long time, is very, very important.
Okay, so now let's transition. So those are some of the causes if you see it, if you can. sense it, bumps, lesions, bleeding, all these things. When someone has cancer, we hear a lot of times that to deal with the medical system, even in first world countries and second world and perhaps third, and mostly in third world countries, managing a medical system is really hard. So once you go in and you know you have cancer, what should you do next?
Go to the hospital, get it checked.
Okay.
The first step usually is a biopsy.
Okay.
Complete history physical to know if there's any other symptoms, then a biopsy. Biopsy is taking a small piece of the tumor and looking at it under the microscope.
Okay.
And that will tell us how the cells are.
Okay.
The cells may be fast-growing cancer versus slow-growing cancer. We can detect that on the biopsy specimen.
Okay. Okay. So biopsy is really important. So if I go to the doctor, if they sense it, they'll do a biopsy.
I mentioned earlier, all these symptoms can be in benign conditions also.
Okay.
That's a biopsy is the ultimate test that
Okay.
tests cancers.
Okay.
And then we do staging.
Okay.
Staging tells us how much disease is there, what other organs are involved, is it spread to other areas or not. And we usually classify that into stage 1, stage 2, stage 3, and stage 4.
Okay, so there's 4 stages in cancer. So once you do a biopsy and you believe someone has cancer, then there's 4 stages. So tell me about stage 1.
So stage 1, for any cancer, it just means it's very localized.
Okay.
And so
It hasn't spread, if you will.
spread.
What does it mean when something spreads?
I think spread, it means it goes along a bloodstream or what they call lymphatics, and it goes to the second area. That's a stage 2. So it's a progressiveness. So stage 1 is local. Stage 2, it goes beyond the primary area it started from.
Okay.
And it ends up being
growing.
It's growing to another spot. It's actually spread.
It's spreading. So stage 2, then what is stage 3?
It's a regional disease.
Regional? Okay.
Regional.
Regional within your body.
Yes.
Okay.
So it's within the region, lung cancer within the lung.
Okay.
So if it's spread to the bone, it's stage 4. So anything below that is
Okay.
stage 3.
From what I understood, the higher the stage, the worse it is. Is that fair to assume?
Yes.
So in terms of treatable with being quote unquote cured, stage 1, pretty good.
Better than 90%.
Better than 90%. Okay, so you want to catch it early is the story there, right?
Again, it's all comers. It's true. Again, you have to be cancer specific, obviously.
Sure. But in
absolutely
generality,
absolutely.
Stage 2, what happens?
Stage 2, the survival rates go down.
By how much?
For lung cancer, it drops another 20-30%.
Wow. What about liver and stomach and prostate?
It's at least the same order of magnitude.
Okay.
Yeah.
So you go from in generalities from a 90% cure rate to you're down to what, 60%?
60 to 50%. I know for cervical cancer, it's basically stage 1 is 90-ish, stage 2 is 65. Stage 3 is more like 50%.
Okay, so between 2 and 3, the percentages are a little less, but still 50-50 is not great. Okay.
Exactly.
Depending upon the site of tumor, like skin cancer, melanoma, if it diagnosed in early stage, 98% are curable.
Okay.
If it has spread to the lymph nodes, only 15% is curable.
Mm-hmm.
So from 15% to 98% is a big jump.
Yeah.
That's why cancer needs to be diagnosed at early stage.
Early. I mean, when in doubt, go in and check it out.
It all goes down to early detection.
And then what about stage 4?
Stage 4 is normally incurable for most of the tumors. That's a general statement as well.
So it's normally incurable.
Normally incurable.
So help me understand. So a lot of families have to make the decision: do you operate or do you not operate? How is that decision made? From what I understand, when you open it up, it's kind of like an exploding bomb. It just goes everywhere. Is that what happens? Why would you not operate and just take out all the bad stuff, if you will? Why would you not do that?
A stage 1 is easily resected with clear margins. The treatment of choice is surgery.
Okay.
So any cancer will have biopsy, which is a surgical procedure. You biopsy the tumor to identify it, and then you stage it. If it's stage 1, the treatment of choice is to do surgery, unless the tumor is in a deeper location.
Okay. And so, but this theory of why you wouldn't do surgery, not because it's going to spread, but it's just resistant to it because you can't cut it out. So now the example I always hear is if it's in a certain location, just take that organ out. Now, I mean, if you need the organ, it doesn't work very well, but that's not the case. You just can't do that.
If the disease is regional or localized, it
Okay.
can be removed completely with surgery. That should be the first option.
Okay.
But usually cancer have what we call roots in this tissue there.
Roots and tissues. Okay.
So you cannot remove it completely.
Okay.
Example is like a weed in the backyard.
Okay.
And weed, if you look at it, sometimes it's removable. You can dig a small
Cut
hole
off the top. Yeah.
and it's gone.
Yeah.
But then there are weeds that have deeper roots there,
Yeah.
and you need to have other treatments.
Yeah.
Are
Okay.
So
That's a
in
great
regional
example.
in a regional disease, surgery cannot take out disease completely.
Okay.
You need to rely on radiation chemotherapy.
I see. So what is radiation and chemotherapy? Tell me about radiation. What is radiation?
So there's three approaches to treating cancer in the modern sense. First is, one is to remove it surgically. That's cutting it out.
Surgery is one. Okay.
That's a branch of knowledge known as surgical oncology.
Okay.
Oncology is a study of cancer, so the surgeon removes the cancer by using a scalpel.
I thought oncology is doctors on call, but it's not that. Huh? Okay.
That too, actually. The other oncology is radiation oncology, which is what I do.
Okay.
We use radiation treatments to focus beams like a laser beam and cut it out. We call it kind of a virtual surgery.
So you fry it, if you will.
Kind of fry it. You kind
Okay.
of, it basically hits the nucleus of the cell stops dividing, tumor dies.
So you prevented the cell growth,
Exactly right.
if you will, by a laser. Why is that so hard?
It's hard because the trick is there's always surrounding tissues around it, normal tissues. We don't want to treat the normal tissues. So 90% of my job is to try to focus in properly and save the normal organs.
Okay, okay.
And the third way to treat cancer is with chemicals. That's using drugs, usually intravenous or tablets.
So how does that work? And is that what chemotherapy is? Yes. Okay, is a short word for it. Okay, okay. So how does that work?
The chemotherapy attacks those cells, the cancer cells in the body.
But you're not shooting a laser. You're doing drugs orally or through.
Chemotherapy is treating the whole body.
Okay.
Radiation is treating more regional disease, and surgery is more localized disease.
So chemo, if it's spread anywhere, it'll probably touch it. So it's preventing the spread as catching anything that's spread as well.
The chemotherapy has two important roles. One is to kill the cancer itself, and second, to make those cells more sensitive to radiation. So radiation becomes more effective if a patient has chemotherapy.
And chemo, I mean, hair loss. I mean, there's a lot of side effects to all this, right?
Well, there are a lot of chemotherapy types.
Okay.
And some chemotherapy will cause more side effects than others. So hair loss is one of the type that certain chemotherapy drugs will cause it, but not all chemotherapy are hair loss.
Okay, okay. What are the other side effects? I mean, I've seen people talk about weight loss and all these other things.
Yeah, chemotherapy can also, it's a general immunosuppressant, so
What does that mean? Immunosuppressant.
Immunosuppressant means you lose the ability to fight infections.
I see, okay.
Because you're wiping out the white blood cells. And so there's phases during the chemotherapy you really become quite prone to infections.
Wow.
So you're at higher risk for getting sometimes life-threatening infections. So, so it's a tough treatment. I mean,
and do you mix the two as well between chemo and radiation?
Most patients will have all three treatments.
All three? Okay.
Surgery, chemotherapy, radiation therapy, depending upon the stage and location of the cancer.
Wow, okay. And what is the difference between a tumor and a non-tumor?
Tumor is any growth of cells.
Okay.
Now, tumors are of two types, benign tumors and malignant tumors.
So growth of cells clumps together, if you will? Is that what happens? And that's where the bump scenario earlier. Okay, and then what's the difference between benign and malignant?
Benign tumor is a localized area disease only. It doesn't spread to other spots.
Okay.
So skin lesion, skin lump, a bump that is there and doesn't spread to other areas is a benign lump. A cancer has a potential to metastasize. It is spread from one spot to another spot.
Okay.
So like a lung cancer when it's spread to the bone, it's lung cancer to the bone. It's not a bone cancer.
Okay. Okay.
It is all the qualities and characteristics of the original tumor.
Wow, that's scary. So now, in terms of, there's a Vice President Joe Biden. I mean, the moonshot on cancer. There's a lot of money going into research. Why is it so hard? I mean, there's billions have gone into research around this topic. Why is it so hard?
I think one reason is because there's so many types.
You said hundreds, right?
Hundred of types. I mean, actually probably thousands.
Thousands, okay.
And then when you're going into, see what's happening is we're realizing it's actually a disease of the DNA. And there's basically DNA disruptions, mutations that are causing these. And we're just starting to learn some of these DNA changes that cause cancer and how we can develop drugs to control the gene expression. I think that's going to be the future.
So this DNA mapping that's happening, that will directly help the research on cancer?
Yes.
Okay. I believe so, because it all started with the genome mapping project from the 1990s. And now we're starting to learn that many of these cancers are driven by certain genetic changes in the DNA.
Okay.
And so we're addressing, so nowadays, for example, my own family recently had a scare of cancer. Fortunately, it was actually a benign. But nowadays, you can actually look at the DNA of a person and do like a genetic analysis to look at your risk.
Interesting.
So that's now commercially available.
Okay.
So for example, if you have in your family a strong history of, let's say breast cancer. Strong meaning 2 or 3 first-degree relatives, meaning a mother and then let's say an aunt, if there's a clustering, you can give a blood sample or a saliva sample and get that tested and get your own risk.
Interesting.
Yeah.
So that's available today.
That's available today.
So that leads me to the prevention conversation then. So I can actually go to my doctor and say, I'd like to be screened for cancer. Is that what I would say? What would I ask for? Cancer
is mutations in the cells. The
Right.
DNA has changed.
Right.
Now only about 10 to 20% is genetics, is familial. It
Okay.
goes from parents to children. Other
10 to 20%.
Right.
Okay.
80 to 90% is acquired damage to DNA, like smoking 22%, obesity 10%, chemical exposure another 10%. So all these are different exposure that we do to the cells. So this is acquired damage to the DNA.
Sure, sure. No, but I guess my question is that going down the prevention route, I can go to my doctor today and ask for a screening for this 10 to 20%, the familial trend. I can address that?
It depends on the family history. It's not to be used indiscriminately, but obviously...
What do I ask for?
So if you have a family history, let's suppose you're getting a screening for, let's say a breast cancer screening and you have a female relative. If there's a clustering, if there's cases in your family, you can mention that to the doctor. Right. Nowadays, there's a whole new specialty called genetic counseling.
Okay.
And they can go through your family tree and look at that risk and see if it's even appropriate.
So at what age should I be asking for this genetic screening? And is that what I'd say? I'd like to be considered for genetic screening. What's the question I would ask my primary doctor?
Taking the common tumors, let's suppose it's colorectal cancer.
Okay.
If there is a history of cancer, especially if you have in your family young ages, 30, 40,
okay,
you want to mention that to your doctor and you want to do the appropriate screening for that.
So ask for the appropriate screening for cancer and as early as age 30?
For some people, yes. If there's a strong family history, that's very appropriate.
Okay.
For most cancers, though, the issue is more like after the age of 50.
So 50 is another marker. Landmark. So what should I do at 50?
A good history physical exam by physician.
Okay.
And then the warning signs should be explained to the patient. If there's any warning signs, then a test depending on that.
So some people do an MRI, right? Okay.
MRI.
Okay. Of something's there. Okay. But if there's strong family history, why not just do an MRI or a CT scan every year?
That's commonly asked, Doc, can I get a total body scan?
Yes.
Let's find out what's going on. Yeah. The problem is when you do total body CAT scans, they're not that sensitive. The tumor has to be 1 to 2 centimeters to spot it even. So that's already getting a little bit late.
Okay.
So in women, the advice is usually mammography, mammogram. You do an X-ray of the breast, usually once a year. Again, there's a bit of a controversy when to start. Most would consider around 40 or 50.
Around 40, you can start the mammogram? Okay.
That's usually an annual basis.
Okay.
To look for lumps that you can't even appreciate. I mean, this is like finding it very, very early.
Okay. And I should do that, one should do that annually?
The mammogram is indicated annually.
Annually, okay.
Yeah. Now, for colon cancer, very common, there's no real good imaging. And the only way is a direct exam with a scope.
Okay.
You put a light through,
Okay.
you look at the bottom, look at the rectum, and you try to find any precancerous lesions. For prostate,
And then,
it's
by
a
the way,
blood test.
that rectal exam, at what age, is 40 the right age to?
It's about 50 for most
50.
people.
50,
Yeah,
okay.
yeah. Again, there's some differences, but yeah, around 50.
Okay, okay.
For prostate, there's no scope, there's no imaging. It's actually a blood test.
Interesting.
So
There's no
generalization.
generalization.
Yeah.
But go back to my most common question. Doc, can I just do a full body scan and at least I'll know if you caught it, if it's already reached 1 or 2 centimeters. And if I do that every year, at least I know you caught it. Why can't I do that?
The scan of the future. At this stage, we don't have a test.
Okay, so that we're not there yet, medically.
No.
Okay. And so going back to these moonshots, what are they doing? What are they trying to resolve? Are they trying to make better early detection? I know there's a lot of folks who work in the early detection. Canary Fund, there's lots of funds out there that are working early detection. Is that a place to really go deep?
If the warning signs are there, then one can go deeper into the system.
Okay.
So a patient comes to me with a lung cancer. I have to look for the symptoms. The symptoms are there or not. And that will lead me to chest X-ray and CT scan and further tests.
So it'll keep going.
But a patient comes with no symptoms in the lung, there's no need to pursue that.
But the early detection there's some research happening in that space. So closing thoughts, 30 seconds, we're in a lightning round now. In prevention, what can someone do? I got the don't smoke, no tobacco, I get that. Beyond that, you said obesity. I mean, how much should I be working out?
It depends. The brisk walking 1 to 2 miles is recommended, or jogging. I personally it's actually daily.
Wow. Okay.
Nowadays, they're saying that if you have a desk job, every half hour to 45 minutes, you got to be moving around. You got to get the blood circulating. Don't just sit. You just have to move. I've seen desks now where you can raise the thing up. So I think these are all little things.
So standing desk is a good idea.
It's actually a very good idea.
Why?
Absolutely. It's all about physical exertion. There's proof that having the body mobilized, having a little bit of more blood flow is actually beneficial. Taking the stairs out of the elevator, movement is good, and that's been shown.
Okay. What else can I do? Prevention.
Sun exposure.
Sun exposure. Okay, so sunscreen.
Sunscreen.
Okay.
Stay
Chicago, you must have less of a problem with sun exposure. I take
Especially
it.
nowadays.
Especially in the winters, huh?
Minus 17-degree temperature.
Wow. But okay, so but all kidding aside, so sun exposure is really important. Wear a hat, sunscreen, is that? Okay.
The skin cancer is increased in magnitude. Usually skin cancer is basal cell, squamous cell, and melanoma. Squamous and basal cell are easily treatable. Melanoma is dangerous. So.
Okay. Closing thoughts.
So those are the preventable ones. There's some things you cannot prevent. You cannot prevent your DNA makeup, obviously. That's where you have the other screenings. Mammogram in women, blood test in men. Like prostate, as mentioned earlier, has no real clear risk factors. It's not linked to smoking. It's just probably just your genetic.
Right. It just happens. Closing thought?
But in men, prostate cancer, in women, breast cancer,
are the two main ones you should focus on.
Both combined together, colorectal cancer is the most common cancer.
Those are your 3 you want to keep an eye out for. Thank you.
Don't ignore symptoms. That's the take-home message.
Don't ignore symptoms. Okay, the 7 symptoms we talked about. Great. We have talked about cancer, very complex disease, thousands of types of cancers that exist, and we talked about how to treat it, how to prevent it. Don't ignore the symptoms. Go see a doctor, ask for exams, and be healthy. Thank you. This has been MTA International Studios in Los Angeles, California, Open Forum.